Imagine a mother excitedly preparing for the birth of her child, attending prenatal visits, decorating a nursery, and eagerly anticipating that first cry. Now imagine that same mother is 3 to 4 times more likely to die from pregnancy-related complications, simply because of the color of her skin. This isn't just a distant issue. It's happening in our communities, to our friends, neighbors, and loved ones. Research from the CDC 2024 shows that Black women in the United States experience maternal mortality rates significantly higher than white women, regardless of income, education, or overall health. When we truly look at the numbers, the disparities become undeniable. Maternal health disparities between Black and white women are not just statistics. They are evidence of a broken system that continues to fail Black mothers at an alarming rate. Behind every statistic is a real person, a real family, and a future forever changed. Maternal health expert Elizabeth Howell, 2018, explains that these disparities persist due to systemic racism in healthcare, implicit bias among providers, and unequal access to quality care. While many assume that factors such as socioeconomic status or personal health choices are to blame, research consistently shows that even high-income, well-educated Black women are still at greater risk compared to their white counterparts. One heartbreaking real-world example is Dr. Shaylin Irving, a CDC epidemiologist who collapsed and died weeks after giving birth, despite being healthy, educated, and insured, Villa Rosa, 2018. Her death highlights how systemic issues, not personal failings, are at the core of this crisis. If we believe in equality and justice, we must take action. In this TED Talk, I will explore the root causes of Black maternal health disparities, analyze systemic inequities, and present proven solutions to close this deadly gap. Every mother deserves to survive childbirth, regardless of race. To understand why Black women face such extreme maternal risks, we must examine the root causes deeply rooted across society. First, social determinants of health, like poverty, neighborhood segregation, and healthcare access, play a major role. Black women are more likely to live in areas with fewer hospitals, lower quality facilities, and fewer maternal care specialists. March of Dimes, 2023. Chronic stress, driven by everyday experiences of racism, also weakens the body over time, increasing risks for conditions like hypertension and preterm labor, a phenomenon known as weathering. Geronimus, 1992. Second, political determinants are equally powerful. Medicaid, the primary insurer for many births in the U.S., historically cuts off postpartum coverage just 60 days after delivery in many states. Lack of insurance is linked directly to maternal deaths, Eliason 2020. States that have refused Medicaid expansion continue to see higher maternal mortality rates, disproportionately affecting Black women. Third, historical determinants cannot be ignored. The United States has a long history of medical racism, from experiments on enslaved women by J. Marion Sims to forced sterilizations in the 20th century. Washington, 2006. This dark history has left a legacy of distrust between Black communities and healthcare institutions, often leading to delays in seeking care or hesitancy to trust medical advice. Cultural factors also contribute. Many Black women report that doctors dismiss or minimize their symptoms during prenatal and postpartum care. Marcelin et al. 2019. Poor communication, stereotyping, and a lack of culturally competent providers mean critical warning signs often go unaddressed until it's too late. Finally, physical determinants such as living in hospital maternity deserts, counties with limited or no obstetric services, increase risks dramatically. March of Dimes, 2023. Over 7 million women in the U.S. live in these areas today. Black maternal health disparities are not caused by one factor alone. They are the result of a tangled web of social, political, historical, and cultural inequities. What if the solution to saving Black mothers was already in front of us, just waiting to be implemented? We've talked about the crisis. We've explored the root causes. Now it's time to focus on real, proven solutions that can change the future of maternal health. One powerful strategy is expanding access to community-based doula programs. Doulas provide emotional, physical, and informational support during pregnancy, birth, and postpartum. Research shows that having a doula lowers the risk of cesarean delivery and preterm birth, two major contributors to maternal complications, Kojimanal et al. In 2016. For Black women especially, doulas offer culturally informed care, build trust, and help mothers feel heard, something the medical system often fails to do. Another major solution is Medicaid expansion, especially in states where coverage cuts off too soon after birth. In states that expanded Medicaid under the Affordable Care Act, maternal deaths have decreased significantly, Eliason 2020. Extending postpartum coverage to a full year ensures mothers can get follow-up care, mental health services, and treatment for conditions like hypertension or diabetes before they turn deadly. But access alone isn't enough. We also need to change how care is delivered. One of the biggest barriers is implicit bias. Studies have shown that unconscious bias in healthcare can lead to misdiagnosis, delayed treatment, and poor outcomes. Marcelin et al. 2019. Requiring healthcare providers to complete ongoing bias training and measuring outcomes could lead to more equitable treatment for all mothers. These solutions, doula support, Medicaid expansion, and bias training, work best together. This is called a multi-strategic approach. These aren't just theories, they're evidence-based practices that can, and do, save lives every day. No single fix will end maternal health disparities, but when we combine personal support, better access, and system-wide accountability, we start to see real progress. The truth is, we already have the knowledge and tools to make childbirth safer for everyone. What's missing is the urgency to act. We can't keep losing mothers to a system that was never built with them in mind. It's time to reimagine maternal care in this country. We owe it to every mother, every child, and every community to do better. So here's my call to action. If you work in healthcare, advocate for doula programs and mandatory bias training. If you vote, support policies that expand Medicaid coverage and maternal health funding. If you're just learning, speak out about maternal health dyspno. Every mother deserves to survive childbirth. Every life we save moves us closer to justice. These aren't just theories. They're evidence-based practices that can, and do, save lives every day.